So we have a special guest today, our expert on plastic surgery, on what to look for with plastic surgery. So welcome, Dr. Balinger. Thank you so much for coming out here and taking time from your busy practice to come out here on our show. Thank you so much.
Oh, absolutely. It's a pleasure.
Yes.
Couldn't imagine being anywhere else today.
Yeah. I'm sure when you woke up yesterday, you couldn't imagine you here talking.
I was skipping over.
Yeah.
You see, that's the kind of surgery you want to put your life in someone's hands like this, lady.
There you go.
So let's find out a bit about you. I mean, let us know about how how did you get into this? How long have you been doing it? Why?
Yeah, those are all great questions. So I think a large influence was just from my family. My grandfather, my great-grandfather were all physicians, and then ever since I was a small child, I always wanted to be a surgeon, a doctor. So it's either that or dig ditches or pump gasoline. Those are all noble professions too,
but you chose surgery.
Yeah,
I think that was a wise decision. I mean, if I had to make those choices.
It was that or nothing. It was or bust.
Yeah, of course. And then if you have a whole family line of doctors, you kind of just go down the family line.
They would have been proud of me either way.
Yeah, exactly. That's awesome. That's awesome. So how long have you been in practice?
I've been in my current office for about 3 years now.
All right.
And then before that, I spent a year doing a lot of reconstruction and trauma surgery. And then I transitioned into cosmetic surgery and body contouring. Yeah.
So going to what you just said about trauma surgery, so can you give us like maybe the most horrific or traumatic one that you've seen that you were able to take part of to be able to give that person back a life?
Yeah, I have a great story. A young man came in and he was in a pretty violent motorcycle accident, and then his face was mangled, and then so it took several surgeries, but we reconstructed his jaw, his skull, the bones around his orbit. Plastic surgeons, we don't just do breasts and skin stuff and buttock surgery. We do a lot of reconstruction. So in that instance, we can really make a huge impact on someone's life, and that's after several surgeries, I had to fix his lips, his jaw, his eyes, and I still get thank you letters and Christmas cards to this day. So it was awesome.
Yeah, and that has to be really rewarding. You know, it's one thing to just like increase to help somebody look more beautiful, but I think that's also something that is not always talked about with plastic surgery. It's like you're being able to give this person a life again after something that has been a traumatic situation that they faced, but to be able to give them on the outside some kind of confidence, some kind of reassurance that life can still go on after this traumatic event. So I mean, that's also like really important to talk about when it comes to plastic surgery.
Right, and in my current practice, and that's really what I do, is I restore people's confidence. I'm a confidence building physician. I improve people's quality of life. Many doctors will give back life or extend life. I improve the quality of it.
Sorry, I need a bit of confidence. I got a question.
Okay.
I got a question, right?
Go.
It's something that I've always thought about.
Consult time. $100.
It's something I've always thought about. When I think of plastic surgery, like you were talking about helping people, give them a new life and everything, right? So imagine me if I wanted to become a plastic surgeon, and I went through the whole medical thing, and I'm very amazing professional. But I am a useless drawer, a useless artist. So I've always thought I would put a nose in the wrong place, or I might not. Like, do you have to have some sort of, I know it sounds stupid, but I've had this question. Yeah. Do you have to have some sort of artistic ability?
I think for sure, 1,000%. So yes, 1,000%. You do have to have some artistic ability. I think people that come from a really strong science background that move into plastic surgery, it's all about numbers and they're very analytical, right? It's all about volumes and remove that much or that much.
Yeah.
Whereas other physicians, and there's really two types, I think. And then some of us bring it together. And then there's where everything's kind of free drawn, and we do all our markings preoperatively. You always have a vision of what you're gonna I mean, you always have a vision that you're trying to create. So you have a canvas that you're given, which is what, you know, whatever your patient's body, you know, the body that they're presenting to you, and then you're gonna, in your mind, you already have an idea of what it's going to look like when you're done, and then you're doing all the steps to get it to that point. And then you know, it's a practice of plastic surgery, right? Because you're constantly practicing. So, you know, as time goes on, we get better, because anybody, I don't know, I don't want to, anybody can take a gallbladder out. No one's ever going to see it. It doesn't,
exactly.
You know, there's finesse and technique in it, but it doesn't, in the end, you may do a little slicker, a little smoother than the next guy, but no one's ever going to see it. Whereas what I do, everyone
sees it, and that's always been my fear, because I'm not afraid of actually the cutting and the blood and the knife and all of that. I'm just afraid that the finished product might not look right because of me.
Well, you don't start from, you know, if you don't start from something, you start from nothing. So you start literally, you don't know how to do anything. And then just, you know, that's why it takes so long to become a surgeon.
Wow, how long typically does it take? Oh, God.
It depends on your path. For me, it took a little bit longer. Some of us are a little slower than others. Just kidding.
But you got there in the end.
It took me 9 years, but it can range between 6 to 9 years.
But I think I would trust you more knowing that you spend a bit more time doing what you do. I mean, if you just told me, no, look, I just qualified yesterday. Now let me cut you open. I may not want you to. So yeah, this 9 years for me, that's a bonus.
Yeah, but I'm still really good. I'm just kidding.
Really nice. So how does, like, for example, say that I now, let's use me again. So I'm going to knock on your door tomorrow and I'm going to ask for a consultation. Like, walk me through the process. How does it work? For those of you that are out there, you're considering it, we're going to have Dr. Balinger's information on the screen. So you can contact him directly, they're going to contact you directly, but what does a typical consultation look like?
Sure, so from when you come in, you greet our front desk, Lizette, and you'll get a glass of water, sometimes a glass of champagne or something. You sit down, just feel relaxed, feel at home, and then we take you to the back. You'll change into a robe, and then Deanne, my patient care coordinator, will come visit with you, and she'll go over your questionnaire. A lot of your forms will be filled out beforehand, so everything's just very smooth.
Okay.
Like, we want to give you just a really positive, confident, inspiring visit. And then once Deanne will come out, then I come in with Deanne. And we sit there together, and I introduce myself, go over and I find out what is bothering you. What do you want to improve? What do you want fixed? And we address those areas. And sometimes we expand a little bit. You know, there's always oh, what about that? What about that? We'll just make sure we address everything. Then I go over the experience, what to expect during surgery and what to expect after. The post-operative care is the most important part. I always tell my patients the easiest part is my part, because I do this all the time and it just takes a couple hours. But then you have the recovery. The recovery takes anywhere, depending on what you're doing, like from a week to 4 weeks. Do you know what I mean? So the patient's really the most invested. And so I explained that whole process with them, what to expect during, you know, every stage of the recovery. And then Deanne comes back and we go over scheduling and pricing and that kind of thing, and that's it. And then we shake hands and we'll see you, you know, in a month.
Sounds good. So it's not like a big scary technical thing where we're going to be blindfolded.
And patients do show up scared. That happens very much.
I
I mean, it's weird, right? Like, who wants to go under anesthesia, the knife, get their body changed? It's I mean, you're right to be worried. There should be anxiety. It's strange if you don't. But it's also for what we do, it's super normal. And like, we're going to take good care of you, and you're going to have beautiful results, and it's going to be super safe, and you have a big smile on your face at the end and feel great.
Okay, just a question. I know this is a silly question, but is there like a age, like I don't know if you've the youngest person that you've operated on, is there like an age cutoff? And I'm not talking about, like you said, the reconstruction, those that have been in accidents and stuff, but like in terms of beauty procedures.
I mean, I do mainly adults.
Oh, okay.
Yeah, it's going to be 21 years or older. Maybe, I think it would be a little bit unusual to have anyone.
A younger.
We want to wait until patients are at skeletal maturity and emotional and mental maturity, and and those things.
Okay.
Yeah.
I think that's super important because when you're young, you want to have all these changes done. You want all these improvements done. It's like your body's not even fully like growing. You haven't really grown into maybe all of your features yet. So it's like just give it some time.
I mean, there may be cases. Yeah, it's a case by case basis, but I think the majority of my patients are going to be in their late 20s or older.
Yeah.
Yeah.
So what about some myths? Because I know there's a lot of myths that are around like plastic surgery. So I have a couple here, but like liposuction. Like I know that some women think that like liposuction is the answer to weight loss. Is there like
Are you telling me it isn't?
I mean, I was hoping it would be because I've been looking for it out for a minute.
Yeah, it's the answer to body contouring. Okay. Not if someone's wanting to lose weight and get the benefits of losing weight, and really what we're talking about is visceral fat, to lower your BMI, then the best ways are going to be exercise and diet, but that doesn't always work for everybody. Now there's a big movement in bariatric surgery. But that being said, in my practice, when we do liposuction on patients, granted with bariatric surgery, you're going to have much higher rates of people coming off their medications, that kind of thing. But you do see it in liposuction, where patients are coming off their hypertensive medications. But I wouldn't do it for that reason.
Okay.
I would do it specifically for body contouring, like you want to improve your body.
Okay. To like reshape it kind of pretty much.
To make you curvier, you don't like especially the waistline. It's such a nice area to liposculpt and get a really dramatic
because then
effect.
You could really see the curves and the enhancement from that procedure. Gotcha. What about so for like the women who are thinking about having breast augmentations done, but they're afraid that then if they decide to have children that they won't be able to breastfeed? Is that something that is accurate? Will you still be able to do that even if you have implants?
You will. For 99% of the time, you will. Okay. There's always we always have a rate of where women will not be able to lactate after breast augmentation or breastfeed after breast augmentation. But that rate's super low. I'd say it's about 1% that can happen. So there's a risk for everything we do, but it's all controlled and these risks are known and understood, and we know how to design the surgeries such that we can mitigate those risks, make those risks as low as possible. So in my personal practice, I haven't had it's never happened, but I'm not saying it can't.
Okay. Well, I mean,
it's super low.
With everything, there's always a risk.
A risk in everything that you do. So,
that's right.
And then they think that just because you have plastic surgery one time, it's going to last forever. Is that true? Like, if you go in there and you get it done, do you have to go back to like get it touched up, or like how does that work? Or does it really last like forever?
It depends on what it is. Like in a facelift, I did quite a few facelifts. And facelift surgery, you will you reset the clock. Same with like breast surgery, you do a breast lift, you reset that clock. And you're, especially in the face is going to be different than the abdomen. In face, you're going to have facial aging, right? So we're resetting the clock. Say we do a facelift or eyelid surgery or both, and we reset the clock 10 years. You look 10 years younger, 15 years younger, which is often the case. But facial aging and gravity is going to take over. So the ligaments that suspend your face, they're going to loosen. The elasticity of your face is going to loosen. The fat will naturally atrophy. Everything will descend and sag. So we're resetting that clock. So it's not going to be permanent. So for facial aging, we reset the clock, and then we say every 10 years, maybe you would want to think about another facelift. So if you get your first facelift like 60, you that's probably going to last you the rest of your life. But everyone's different, right? But if you do like a tummy tuck will last you a very long time, probably longer, because just the effects of gravity and things just aren't the same in the abdomen as in the face. It just all depends how you take care of it. Yeah. If you get pregnant again, you know what I mean? Like, okay, well, you're probably going to need another tummy tuck. So, but if you take care of it, you work out, you diet well, you probably don't need anything ever again. Do you know what I mean?
Yeah. So on that note, he's been giving us a lot of really, really good information. I know that our viewers are soaking it all in, but we're going to take a quick break, and then we're going to be right back with Dr. Balinger.
Universal Living Faith Network, where faith is alive.
All right, so welcome back. So we are now going to ask, what are some red flags that people need to look for whenever choosing a plastic surgeon?
Well, I think the most important thing is that the surgeon is trained specifically in plastic surgery. That means completing a residency or a fellowship in plastic surgery. I think out there that there's a lot of people trying to compete in the cosmetic surgery market, and they're doing things by getting a cosmetic certification, and anybody can go practice plastic surgery. Just hang up a shingle, you're a medical doctor, you can do these things. So it's very important for the patient to understand that there's a big difference between a plastic, a fellowship or residency trained plastic surgeon and a cosmetic surgeon that is really a medical doctor, an OBGYN, or a dermatologist doing these things. So if you want to do everything as safe as possible, that's the way to do it. Another way is you look at their galleries, look at their photos, look at their Instagram, especially their Instagram. They're going to be posting things all the time, and you can see the quality of the work. Yeah. There's a big difference.
Well, that's really interesting, because I had no idea that there was a difference. And I thought it was the same thing.
And remember, things don't always go well after surgery. So as a plastic surgeon, like, we know how to take care of problems as they come up. Mm-hmm. So you want someone that's going to, you don't want someone to just get you through the surgery. You want someone that's going to get you through the finish line. Mm-hmm. So if problems come up, they can take care of it. A lot of these people that are doing these things and that aren't trained, they're not going to be able to do it or not do it well, or I just wouldn't have confidence in that.
And that's where the complications come into play.
Yeah, you want someone that knows how to when to properly anticoagulate you, when to prevent you from blood clots. What do we need to do? Are we doing compression? If you have a wound, how often are we doing things like hyperbaric oxygen to your wounds? Are we debriding your wounds? Are we putting on antibiotics, IV antibiotics? How long? All these things that we think about every day, and have all kinds of experience, especially in training. That's when you learn it all. You don't want to be practicing on your patients and trying to figure it out then. You already have to know.
Yeah. Yeah. Well, thank you so much.
Yeah, Dr. Balinger knows what he's talking about, guys.
It's a big deal.
And it's nice, because you know what I was thinking? I was thinking, just by hearing you talk, everything that you've spoken about in this interview, it's been really soothing, because I just think a person, I was going to ask you, like, how do you calm a person down that comes to you for a consultation and they're so self-conscious about themselves, they've maybe been in a horrible accident, they don't even like to look in the mirror, like, how do you calm someone down? But just by having you talk in this interview, I'm calm already. Yeah, I feel good, and I think this is really important.
The surgeon, you have to be confident, and you don't fake that. Yeah. That's just like we've been there, done that. My team has been there, done that a million times. The majority of things, I mean, I've seen, like, we've taken care of like stuff you couldn't imagine. Yeah. So this stuff's like no big deal.
And have you ever had to turn anyone away? Like, is there someone that would say, no, sorry, it ain't happening?
Yeah, it happens. Yeah, occasionally.
Which is nice.
It's not ideal, but there's, people just want surgery for the wrong reasons.
Yeah, okay.
And that would be that's probably the main, that I can think of reason. Yeah.
Okay.
Yeah.
Well, thank you so much for taking time out, coming out here to give all of our viewers all this really important information so that they know what they need to do next time when choosing, a physician that's going to be able to give them the look and the care that they need, and the aftercare that they're going to need after the procedure, because like what you said is super important, because that's when all of the problems really come into play. It's with the blood clots and all of the aftercare. If it's not done properly, that's when all the problems can happen with the surgery. So thank you so much for coming out here and spending time on the show, and giving all of our viewers this great information. Yeah. Can you tell our viewers where they can find you, where they can find you on social media, so that maybe they can hit you up?
Sure. So my Instagram is Beauty by Balinger, and then my website is www.houstonplasticsurgerytx.com, and then you come visit us. Our office is located in the Heights on Yale and 19th Street, so yeah, come visit us.
All right, thank you so much for coming out here. We really do appreciate it. So this is it for our segment on plastic surgery. I hope you really enjoyed it. Use his phone number, give him a call if you have any questions or concerns, or you have family members that want to have this procedure done. But for now, we're going to take a quick break, and we will be right back with Breaking the Silence.
Do you live in Houston and want to be featured in our program? Call 1-888-332-4141 or text us at 1-888-312-4141. Let us know why you think you should be featured. Who knows? You could be our next guest.